Hello, everyone. Myself, Dr. Ashwini Kumar. I'm a faculty of Human Anatomy at Dr. Bhatia Medical Institute. And I'm very happy and privileged to have Dr. Prem with us. Dr. Prem secured rank 2 in the recently conducted NEET PG exam. Well, rank 2, yeah, you heard it right. It's rank 2. And I'll first request Dr. Prem to formally introduce himself and tell about his parent college and where he actually belongs to.
Good evening, sir. My name is Prem Thilak, and I'm currently an intern at BJ Medical College and Civil Hospital in Ahmedabad. I live in Vadodara with my parents, but by origin, I'm a South Indian.
Okay,
Yeah.
wonderful. Well, Prem, first of all, formal congratulations for what you have achieved. I'm sure you must be bombarded with congratulations, and I'm sure the news must have spread like a fire in family, friends everywhere, and I'm sure you must be very elated at this point of time. Uh, First of all, I want to tell us ki how does it feel to be a rank 2? I mean, I'm sure you must have dreamed of getting a good rank, but जब rank 2 हो जाते हैं तो what is the mindset right now?
So I don't know actually. I'm still processing it, to be honest, because I've not had such amazing ranks neither in my university exams or even in my NEET UG. So this is a totally new experience for me, and I'm still processing it. But at the moment, I'm just trying to enjoy it and share it with my friends and family and everyone who's inspired me to be here. And I'm grateful for all the good wishes I have got from juniors, seniors, colleagues, friends, family, relatives, teachers, and everyone who I've been acquainted with in whatever way possible.
Wonderful. Dr. Prem, which brings me to my next question here. You said that you never experienced this being a top ranker in this college and all, and in university exams. So that basically gives a boost to the people who are like mid rankers or like so-called average in their studies, and they still could crack rank in top 10, top 100. So tell me something that when you gave that exam that recently conducted the NEET exam, were you expecting the rank like this, or were you like, ki, exam went well, so I'll get a decent rank?
So the exam was overall well, but there were quite a few questions which had controversies. If you
Yep.
thought about it from one point of view, there could be an answer. If you thought about it from other point of view, there was no uniform guideline which you could refer for some questions. So I had kept a leeway of about 10 questions, which give or take you could get right or get wrong. And depending on that, I figured that I should get a rank at least in the top 50, if it was a worst case scenario. And in the best case scenario, I figured a top 10 position would be ideal, but rank of 2 is beyond my dreams, to be honest.
Wonderful. Okay, but you know the worst case scenario, you said you thought you'll get a rank of 50. That means your exam really went well, and so let's talk about your journey. Like when you started preparing for PG. Like I would obviously not consider that during first year we generally don't think about preparing for PG exam. So when did this the ignition started? But was it like in the second year or later?
The latter part of second year, I should say.
Later part of second year. So how? I mean, what did you do? Like you attended classes, or you like watched online videos, or like you knew that what is being asked, or you followed the MCQs, and that's how you prepared about it, or
So I'm not an offline guy at all. I
okay,
can't stay awake in offline classes for long. So I preferred online videos. And
okay,
I stuck to, for the first and pre and paraclinical subjects, I used to read textbooks thoroughly, because if you get your concept strong, it helps you revise faster and it helps you retain better. And if your core is strong, you can always add to that in clinical subjects, in medicine and surgery. So, and for the final 2 years, I used mostly notes and videos, and started giving tests by about the latter part of the first part of third my professional MBBS.
okay, okay. Well, okay. Dr. Prem, basically my next question is from this point only, that you said ki you started preparing, you basically read mainly the textbook for first and second years. And now when we know that next is round the corner, the people are talking a lot about key clinical subjects are more important. You probably have to give more stress to the clinical subjects. And there are, I know first year students who asked me, said, do we have to read anatomy like in detail, or can we just read for the examination only, so that we can focus on clinical? And the interviews which I took for any ranker, they told me exactly what you're telling me, that they basically paid more attention or stress to the first and second year subjects. So what are your thoughts on it? Like how you think, what is the importance of first and second year subjects not only being a good doctor and also to crack this all these PG exams?
So a common misconception in first and second year is that they are not very important and you have to just study in the last 10 or 15 days to crack the university exams. And I've seen many people get good ranks and good scores with that approach as well. But the problem is that it gives you only a very short lasting memory, and that's gonna come up short sometime or later. So if you have worked hard throughout your first and second years, if you have revised, it doesn't matter if you don't get a university rank in the first or second years, because you might not have a very good short term memory. But the benefit is that you are going to retain it for a longer period of time. So when you eventually start preparing for NEET PG, you are going to have a stronger base than people who have crammed it up in the last 10 or 15 days. So people think it's a 15 days work will get me through the next 10 days, but it's the 1 year's work which will get you through the next 5 years. So if you think in the longer run, it is better if you revise it throughout the year rather than in the last 10 days of before your university examinations. And if you have a good core in your first and second year subjects, that can even help you solve questions from the clinical subjects. For example, if your anatomy is strong, you can easily solve questions from surgery, or you can at least rule out some options in surgery, which might help you get that extra 10 or 15 MCQs correct in the actual examination.
Basically, the clinical subject will become just a pile of notes which you just will be mugging up if you don't have a good core or the good basics here, and you won't even enjoy those cramming or mugging up things if you don't have core.
Yes,
Well,
sir.
very well put, Dr. Prem. Dr. Prem, tell me something about that. When did you start giving tests? I mean, the grand test, which we call it. Like, were you like regular with the test, and when you started giving them?
I started giving the test in the later part of and towards the end of the first part of my third MBBS. And even I think that's late. When I talk to some of my juniors who are consistently giving GTs, they have started giving GTs at the beginning of their first MBBS. And the problem is many people think that don't get good ranks in your GT, so it is better to complete your syllabus and be fully prepared. But there is no time you're going to be fully prepared. The syllabus is so vast that you're going to keep forgetting something. So the earlier you started is always the better. And at first, even I had hesitations before starting my GT journey. But once you start getting scores, you will know that the only way is upwards. So you will have to keep giving GTs irrespective of your scores, review them, and the most important part is to continue giving them and not lose hope.
Okay, and let's say if a second year student in the later half of second year they start giving, so obviously the grand test will include the questions of clinical part as well. And so what do you suggest them? Like, should they try those questions as well, or like should they guess those answers, or they should like just test themselves for the subject they have already read?
I think that should be really individualized, because I can't really comment on that because I haven't given my tests. I used to give tests when even I was not prepared with obs or surgery. But like I said, when I started giving tests in the latter part of my third year, I had not started reading medicine at all. But using physiology and microbiology and pharmacology, I was able to score at least 30% of the questions from medicine.
So
At
rule
least
out.
the drugs of, yeah, I was able to rule out, or I was able to arrive at calculated guesses. So you should attempt all of them, and while reviewing, you should see if you can correlate with them with concepts you have read in your first and second year subjects.
Okay. Dr. Prem, I have to ask you this question, because I'm always sometimes the people when we go to take the classes and we ask them, "Ki, okay, what rank you are looking for?" So they say, "Okay, we're looking for a rank with 1,000 within 100." Nobody talks about getting a rank in like top 10, because they think कि ये लोग तो superhuman होते हैं. They are like there's something human beings who get a rank. So I wanted to know that apart from studies, what are your hobbies? Like, what do you like to do in your free time? Do you like watch series and all? Do you play games and all? I wanted to know because it's really interesting to know.
So I love football, watching as well as playing. I watch all matches of my favorite team, be it in the dead of the middle of the night or in the evening. I always make time to watch because that is something which gives me a good night's sleep, and it gives me something to relax myself and my body with. And I even play football on weekends or whenever my friends and I get the time. So that keeps me fit and also refreshes my body and mind. And they say a healthy mind and a healthy body both are equally important. So it's also important to keep yourself very fit, and also uh, take out time for hobbies and other pastimes so that you don't lose yourself in books as such. And to people who think that it is easy for toppers to say, 2 years back, 2 years back, I was looking for a college in college in Kerala, which is where I eventually aim to settle. So that time, the closing rank for medicine in Trivandrum was 69, and I said, this is not possible. I will have to settle for a state quota seat in Gujarat. Is what I told my parents as well. And I was even considering pediatrics as a backup branch, pediatrics in state quota. So the problem is a lot can change the way you approach your strategy, and it's important to not lose hope. Even I was pessimistic before starting my examination, and that is not what I would advise, because you should not judge where you will be based on where you are right now. It doesn't matter where you are right now, because all that matters is where you want to be. And I'm really grateful that I've been able to make that leap, and to be able to be in this position is really great.
Well, you mentioned football, so I have to ask you, what's your favorite club?
So Manchester United.
Manchester. I was a Manchester fan, but I switched to Liverpool then. But anyways,
Oh, so
uh, Doctor, I also wanted to ask you that, do you also have the concept of 20th notebook? Like, there's too much to revise at the end. So either you call it a 20th notebook, or you just say, like, what was your strategy in the last 1 week, when just a week before the exam, when you have read so much throughout your 4 or 5 years, then how you were able to revise it here? Because that's the main problem which everyone faces, that not able to revise.
So I used to, for when I first used to watch videos, I used to pick up things which I felt I would forget, and I used to make a separate note of that. So, and after that, I used to revise the notes I had made. Secondly, the so-called 20th notebook, and I used to trim that down. For example, if you go through the 20th notebook once in a month or so, there will be things you will become confident with, and the size of that 20th notebook keeps on decreasing. So if and also in the 20th notebook, if you can prioritize subjects as weak, strong, and intermediate, you can give greater time to your weaker subjects, and you will be able to go through your stronger subjects relatively faster. So in you will be able to cover your 20th notebook in 1 month at least, if you have been thorough with your revisions and frequent. In the last week, I personally told myself not to revise too much, because too much knowledge can also be dangerous, and it can result in a blizzard of thoughts during the examination: wanted thoughts, unwanted thoughts, good thoughts, negative thoughts, everything. So I used to keep my preps to a bare minimum. Used to revise that final little set of notes I had made, especially my weaker subjects, which were the surgical branches. And I used to also relax on the side while watching TV or listening to music whenever I could. So the last week is, it's important to not get carried away with too much prep.
Okay. I don't want to ask you the question like how many revisions you have done, because I think it's a very individual thing. Some people say that I've revised it twice, some say I've revised it 10 times. So I think it probably vary from person to person, but individually only, like how many times were you able to revise your whatever like set of notes you had?
So as I said, I was weaker in the surgical branches, mainly orthopedics, surgery, and gynecology. So I had to revise those notes approximately 4 or 5 times, especially the short notebook I had made. I used to revise it almost every other day. For example, I would do orthopedics one day, and then I would do ortho obs for the next 2 days, that way. So that really helped me retain things. But for the subject which I was already stronger in, such as in pharmacology, medicine, and microbiology, I used to keep it to, I must have revised it about 2 times. Yeah, all subjects I did a minimum of 2 times, but for the weaker ones I had to go for 2 or 3 more revisions.
So basically you streamlined and trimmed the subjects which were vast, and you kind of kept of revising the same thing over and over again, rather than like increasing too much of content to the same thing.
Yeah,
And
because
FOMO that everyone has, like the moment you go to some social networking site and they will see some question, it suddenly pops up, and then you say, okay, I don't know the answer to this question, like my preparation is not good enough. So you also had that kind of feeling, or like you refrained from using any kind of social platform?
nice. So actually, I use social media quite a lot towards the end, because I used to follow a lot of medical pages and stuff. And especially Med Twitter is a very good source of information if you follow the right sources. So once I went on Med Twitter, I realized this is so vast. The mass of knowledge we have is ever increasing, and it is not possible to know everything. It is also unrealistic to expect one to know everything either. The important part is you have to always accept the fact that learning is a lifetime process. There is no point when you're going to be able to, I am going to be able to solve all MCQs in the examination, or I'm going to be able to diagnose all patients in one go, or I will never have a wrong diagnosis. Even the best clinicians have wrong diagnosis. We are barely at the starting point of our careers. So it is not important not to get disheartened when you solve, even you're bound to get even silly mistakes wrong. Silly mistakes. Everyone makes silly mistakes. Even the best of toppers make silly mistakes. So if you make a same mistake in multiple times in the same concept, I think that concept needs to be earmarked for revision. But otherwise, I think the odd concept is bound to slip out of your mind. So I made peace with myself that if I am remembering, say, 98 out of 100 topics, that should be more than enough. I can try that little bit more to increase that to 99 or 100, say, ideally. But that should not be at the cost of compromising the 98 I have already revised. You should not try to remember extravagant things for risk of losing the basic ones that you already have.
How much of emphasis you give to the, you follow on those topics, or you like reading anything and everything that comes my way?
So the first reading should be of everything basically, but the more revisions you make, you should be able to whittle down to a set of topics which are frequently asked. And if you go through previous year questions, so you will find that these topics have to mug up, or I have to remember. There are some scores which there are people say everything is conceptual at times, but I feel rote learning is also an equally important part. If you are to scores and staging and stuff has to be learned, so that has to be learned. But I truth be told, I did not have a specific strategy for previous year questions.
But follow previous year questions. You actually
Yeah,
solve.
yeah, yeah,
Okay.
yeah.
Well, Dr. Prem, now coming to my final question, that is that you already do, and I'm sure that you will get the seat in college of your dream. And there are obviously there's a big chunk of people who worked hard, but they could not make it to this exam. So I think you are the people right now basically are also having a moral responsibility also to guide those people that what should they do, especially for this INICT exam, because people are very skeptical about this NEET or next exam. So they don't want to target like next January or December. They want to like do it in this INICT. So tell us honestly and tell us with a mindset that someone wants to get a decent rank, like maybe not in top 10, maybe not in top 100, but a decent rank in INICT exam. From now onwards, what are the couple of things they do and how should they go about it?
So for INICT, I have seen previous year's INICT questions and stuff, and I think what this depend on more than what your knowledge is how confidently you attempt questions, because their concepts they test, yeah, sure, about quite a few of their questions are very conceptual, but they also test how confident you are at answering those questions. So if you have gone through previous year's question, and everyone knows that INICT loves previous year questions, they will rotate, they will revolve around one topic for 10 years or 20 years, and they'll go through the depths and breadths of that topic to find another question from whatever source they can. So it's important to go to those. If you have a list of those topics, then very well, or if you can find a list somewhere, then it would be ideal. And you have to revise those topics as far as possible. Apart from that, the concepts which you have learned in NEET PG are going to serve you well in INICT as well. But like you said, sir, previous year questions carries a massive weightage in INICT, much more than that in NEET. And it's also important to be very confident and not lose hope. I know it's not difficult, for it's easy for me as a topper, people might say, and it's a fact as well, because many people I've found myself helpless on how to guide people, because they might feel helpless, and I might not be the best person to guide them all the time. But it's important not to lose hope even if you get a bad score in a mock test, or even in this NEET PG 2023, because you always have a second chance in life. So it might sound philosophical, but that's the truth, I guess. So that's it, sir.
Okay, you're right. This thing is that the INICT is more about no, they keep on asking the same question over and over again. They language artically that every time it looks like a new question only. So if you don't know that, right, you rightly said if you don't know the language of that topic here, then you're again going to miss on that. I mean that's INICT. That basically they're asking you the same
Yes,
topic,
sir.
doing it every year. So that
Yes.
means although we call it it's a very predictable exam, but you need to be very solid at those, and you right very rightly said that you have to be very confident. And at times the exam like INICT, it's more than the question which actually it's the option which confuses you. A, A, both are correct. All three could be the answer. So that's what the beauty of like. Well, Tim, thank you so much for your time.
Thank you,
I,
sir.
very last, I want you to take your time, and if you want to thank anyone in your life, your family, your friends, anyone who helped you achieve this rank, please take. Just go ahead.
Everyone deserves credit. Everyone who I've known during the course of these 5.5 years, and even before that, my parents, my brother, my relatives, my teachers, my colleagues, juniors and seniors alike, not just seniors. Even juniors have always inspired me and always pushed me to my limits. And one dedication I would like to make is to my grandfather. He passed away a week before NEET PG 2023, sadly. And he was the one who wanted me to be a doctor, and I'm the first doctor in my family actually. So it's a great feeling to be able to help him realize his wish, and I would dedicate this achievement to him.
Okay. One last personal question.
Yes, sir.
Out in Liverpool, who will reach the last four?
So it's, I don't think it's a question anymore, is it? It's Manchester United. I don't see how you are. I don't see how you are hopeful. Like, okay, you might oust Tottenham Hotspur at some point, I guess, but not Manchester United. So just because you meet us 7-0 once.
No, when you change your club, na, the same club performing well, then you
Yeah,
fall back to the same club. But
yeah. It's like when your school ex-girlfriend suddenly looks more beautiful than. uh,
so much for your time, dear. Thank you so
yeah.
much.
Thank you, sir.
Thank you, sir. Thank you, Dr. Prem.
Thank you, ma'am.
Well, Dr. Prem, ये तो edit करके लगाएंगे वो उसको. This is done.
Yes,
Um,
sir. Thank you.
yeah, it was wonderful talking to you. Okay.
Same here, sir. Mutual feeling.
Yeah. And
Yes.
I'm still in Gujarat only.
So, sorry, I didn't get you. There's a voice.
Only right now you're in Ahmedabad only, or you are back to your hometown?
I'm in Vadodara, sir, in Gujarat. Be going to Ahmedabad tomorrow.
Okay. Chalo man, enjoy your time.
Okay.
Have a
Yeah. Thank you, sir.
and यार मैं पूछना भूल एक्चुअली इंटरव्यू के टाइम में. What are you planning to take? I mean, what's your plan?
So, medicine. I've always been fascinated by medicine. So at present, my options are Delhi. In a good college in Delhi, I'll have to ask around MAMC or RML. I'll have to ask around with seniors and faculty members.
Yeah, I think like I think there should not be any confusion in that. But ठीक है. Okay. मैम like I मैमसी और आरएमएल में तो मैंने ज्यादा चॉइस कुछ सोचा नहीं. That has to be the मैमसी for sure. But okay. तो अब are you planning to give INICT also? Any plans or like हो गया बस अभी?
नहीं, sir. I will definitely give INICT.
Because you never know if you get an medicine seat, if you can crack uh,
Aims of PGI would be great, sir.
nothing like that.
Yeah.
No, right now अपने confidence level एक अलग ही level पे है. You know that you are done and dusted with it, and you can go into the exam like a bare soul. आपको कोई डर ही नहीं है अभी.
But I don't want complacency to creep in and cost me a seat in the INI.
Because this is what we've seen last time also. पहले भी जो नीट में इनके रैंक्स आते थे ना जनवरी वगैरह में, they used to get the rank 10. और जब ये next INI होता था तो when they used to go for the NIMHANS exam especially, what I've seen is that generally the NEET ranker, they were the same ranker which were in the NIMHANS exam, and they usually go like without studying. वो बिना पढ़े ही जाते थे एग्जाम के अंदर, फिर भी they were able to like score very well here. So I would love to see you in MAMC or like RML medicine or nothing like that if you could crack a medicine seat in AIMS Delhi.
Yeah,
Right?
sir. Hopefully, sir. May your words come true.
Yes, yes, yeah. All my good, man.
Thank you, sir.
And thank you so much, man, and good night.
Good night, sir.